I know it's not a politically correct thing to say, but I'm okay saying it. I'm starting to see it at an earlier age, which is really scary.
Is that where their brain stops telling the body to do certain functions?
Meet Dr. Josh, a Harvard-trained physician revolutionizing Alzheimer's care. In this episode, he discovers how lifestyle changes and cutting-edge treatments can reverse Alzheimer's and restore hope.
Take someone whose brain is not working and get it to start working again. We gave her 6 doses of this medicine. We got her memory back. She told me, "You gave me my life back." But my message is one of hope, because I've been in this field for over 7 years, reversing Alzheimer's. You've been told by a medical doctor or someone else there's no hope. That's not true. There is hope.
All right, everybody, this is Dr. Josh, and we're going to talk to him today about reversing Alzheimer's and amongst other topics. But Dr. Josh, welcome.
Thanks. It's always great to be with you. Yes.
Now, one of the things you're passionate about is reversing Alzheimer's. When you say reversing, what do you mean by that? Is that a cure for always, or is that somebody who has it in deep stages to come out of it? What do you mean by reversing?
Yeah, so by reversing, I mean take someone whose brain is not working and get it to start working again. And let me just be clear, I'm also focused on preventing Alzheimer's, but also, it's a lot easier to reverse someone with mild Alzheimer's than someone with severe. It often takes a lot longer with severe, but my message is one of hope, because I've been in this field for over 7 years, reversing Alzheimer's, and I know it's not a politically correct thing to say, but I'm okay saying it because I've been doing it, and that's what I'm doing now. That's my focus, and I enjoy it. And giving people their brain back is giving them their life back. So that's amazing.
Absolutely. We all want to have a great body and we want to be healthy and avoid diseases, but Alzheimer's is such a common and becoming more common as a later stage disease today, but some people are suffering it younger and younger. Is that true?
Yes, it's very true. I'm starting to see it even in people in their early 50s. So, there are some rare genetic types or less common genetic types that we see in people in their 30s and 40s, but the garden variety Alzheimer's, I'm starting to see at an earlier age, which is really scary for all of us.
Now, there are different names for Alzheimer's, because I've heard it identified as different names growing up, Alzheimer's, and then, what are some of the different labels or tags of the same thing?
Sure. So I think what you're getting at is there is technically a difference between dementia and Alzheimer's. Alzheimer's is one type of dementia, meaning the brain is not functioning well. Other types include after a stroke, Parkinson's. Sometimes you'll see dementia. There are rare types like PSP. There are many. There are many different types. If you get head trauma, that can definitely cause dementia. But I often use the two interchangeably, even though they technically aren't, just because Alzheimer's is the form of dementia that most people have heard of.
Sure. And what are some of the reversible ways or things you do? Is it through medicine? Is it through drugs? Because you are a medical doctor.
True.
So what are the ways that you use to reverse it, and how has your success been? Because commonly, according to the medical society, is there a cure? I don't believe there's a cure, right?
Well, I would argue there is, but hear me out. When we use the term even Alzheimer's, normally they're between 30 and 200 root causes. So no, I don't think you're going to find a magic pill or medication that's going to fix all 30 or 200 all at once. But that has been the approach up until now for certainly big pharma. Hey, let's find the magic pill. And the cool thing is, yes, I am using an FDA-approved drug for compassionate use to decrease the amount of inflammation in the brain, and I'm seeing reversal in many of my patients with that. But let me just be clear that because Alzheimer's is such a complicated condition that normally you need to layer lots of different treatments, not just this FDA-approved drug for compassionate use, but I would actually start with lifestyle. lifestyle, making sure that people are eating the right foods, not eating the wrong foods, that they're getting enough sleep, that they're decreasing their stress, that they're exercising. And frankly, I think lifestyle is more powerful than any other treatment I can come up with. But to my mind, if you have someone, by the time someone has Alzheimer's, they've had severe damage already to their brain. I would not take anything off the table. I would use everything. I would use lifestyle. I would use lots of different supplements, potentially medications, other medical procedures if toxins are part of the equation, to remove toxins from the body. So to my mind, I would use everything. And because this is complicated, I think that's one of the reasons why traditional neurologists or medical doctors have not yet gotten on board with this.
When you say a compassionate use to a drug, FDA drug, what does compassionate use mean?
Sure. So it's a program under the FDA. They call it Expanded Access Program. And basically for this medication we're using, which lowers inflammation in the brain by actually inhibiting a lectin. Humans also make lectins, an inflammatory protein that is often elevated with Alzheimer's. What this drug does is it basically it's an antibody that attacks and binds to the galectin-3, and using that, it lowers the amount of inflammation. And the reason we have expanded access to give this medication to patients is because so far we've seen 0 serious side effects, and we're seeing really good results, often after just 1 dose. So that's the reason why it's under the compassionate use program. I'm able to offer it to some of my patients. There's an application process. It's not like I can just go give it to everyone. There's a whole process. But if the patients qualify, and most of them do, I'm able to use it as one of the many tools. But to be clear, it's not the only thing. While we're doing that, we're also trying lifestyle, because if we don't do other things, they're going to be potentially stuck taking this every month for the rest of their life. It's expensive. We don't want them to do that.
Sure. And how does somebody get diagnosed with Alzheimer's? Because we know memory loss is the suspicion. Okay, somebody has a memory loss. What's the official diagnosis? Is there a particular test or a set of tests?
Sure. So, and that's really changed over the last few decades. When I was back at Harvard Medical School learning this originally, I was taught the only way to diagnose Alzheimer's was at autopsy. At autopsy, you take brain tissue, you look at it under a microscope, you look for amyloid deposition in the brain and other changes like that. So that's the past. The exciting new thing is we now have different ways to diagnose Alzheimer's much earlier. One of them is a blood test looking for amyloid and tau proteins actually in the blood. Another is to get a PET scan of the brain, specifically looking for amyloid or tau proteins in those patients.
How early can somebody be suspicious that they might have it?
Yeah, so it's interesting. It is fascinating because often it can take 30 years or longer for Alzheimer's to develop. And the first 20 years, someone may not be aware of it because normally the brain has amazing redundancy. And for that reason, by the time someone starts repeating things or forgetting where they put their keys every few minutes, by that time, there's often much damage that's already been done.
Why did it traditionally strike people much older, but today it's younger?
That's a great question. I'm concerned that one of the reasons is much higher levels of toxins, fatty toxins, heavy metals that people are getting exposed to today. And these fatty toxins like PCBs, DDT, man-made chemicals didn't exist hundreds of years ago. But what's scary to me is when I do testing looking for levels of these fatty toxins in the urine, though I'm seeing higher and higher levels in my patients now compared to 10 years ago. So I'm worried that in our society, as we are manufacturing more plastics, more chemicals, I mean, sure, I enjoy the benefits of technology, of this technology. What I'm worried about is many of these fatty toxins have gotten into the food supply, they're in the rainwater, and now they're inside of us, and there's more of it. And unfortunately, many of these toxins are endocrine disruptors, but they also disrupt the brain. And so my concern is one of the reasons we're seeing Alzheimer's and other dementias at an earlier age is because of higher levels of toxins. I think another one, frankly, is lifestyle. I think, unfortunately, people don't exercise as much as they used to, and potentially under higher stress. So I'm not saying it's all chemicals, but I'm really worried about this.
How much do genetics play in somebody being diagnosed with this?
Yeah, so genetics definitely has a role, and it's not just apolipoprotein E, specifically E4. It turns out there are literally dozens of different genetics that can either increase your risk or decrease your risk of getting Alzheimer's. So that's one of the reasons in my patients, we will normally get full genetic testing to look for it. But let me just be clear, I don't think the genetics in this country has changed much in the last 50 years. I don't think we can blame genetics for the increased rate of Alzheimer's that we're seeing.
You've mentioned lifestyle several times, and you've mentioned diet several times. Is there a particular diet that you've seen to work best for helping people that have been diagnosed with Alzheimer's to help contribute to reversing it?
Sure. There have actually been a couple diets that I've seen that have been very helpful. I think actually the most important thing is to cut out processed foods. That's number one. And also to stop eating about 3 hours before you go to sleep. So those would be the first two things I would look at. And then I've also seen dramatic improvement using a diet just based on raw foods, so fruits and vegetables. And I've also seen improvement with a ketogenic diet. And I've also seen improvement alternating from ketogenic to a raw diet. And I just also want to say that I don't think that one diet is going to be optimal for everyone. So for example, if I have a patient who's very underweight, I may be giving them lots of oils and other fatty foods to help them gain weight, but I wouldn't treat someone who's overweight and insulin resistant and diabetic the same way. So we talk about diet. I don't think there's one special diet for everyone, but I think there's some general things for people to do, specifically cut out processed foods with added salt, oil, and sugar, and also try not to eat right before you go to sleep.
Okay, you've mentioned processed food several times. You've mentioned salt, oil, and sugar. So for the viewers that don't really understand diet, what do you mean by processed food?
Right, so I mean food that you can't get from a tree or from the ground. A food that doesn't look like it was. It looked like it was created in a plant, in a industrial process, not something that you would recognize like, oh, I could have grown that outside in my garden.
Yeah, basically, one way I would define it is something in a bag, box, container, or a can.
Sure.
Is that a good way to describe it for people that are curious? Because the average person that has Alzheimer's, they hear don't eat processed food. I mean, somebody once told me bread was raw because it's cold. People have no idea about this. So you're basically saying fruits and vegetables are not processed and everything else is?
Yeah, I am saying that, but I mean, we could delve down, and you could talk about there are different types of grains, and they're processed or less processed. Same thing with fruits and vegetables. You've got raw, and then you've got things that are cooked a little bit, and you've got things that are fried. I mean, they're definitely different degrees. And what's frustrating, I know, for the general public is if you go into a typical supermarket, 90% of the stuff there is going to be processed. So you really have to seek out things that are not processed. Same thing if you go out to eat, most of the food that you're going to be getting is going to be processed.
Okay, somebody's been diagnosed or knows somebody in their family diagnosed, and they want to start feeding them in a healthier way Give an example, maybe of a day's diet, what they should be eating.
Sure. So I would focus on trying to get as many servings of fruits and vegetables in their diet. And by vegetables, I don't mean ketchup. I mean actually tomatoes as an example. So as an example, I would start breakfast. Well, first of all, I don't think you necessarily have to eat first thing in the morning. That's number one. There's this concept of intermittent fasting where you tighten, you have a limited feeding window. You may only eat between noon and 6 p.m. as an example. But things that I would eat fruit, whether it's watermelon or apples, vegetables, definitely get leafy greens, get beets. That's basically what I'm talking about. And you want to maximize the number of servings. And I know it sounds crazy. In this country, traditionally, people will not eat vegetables for breakfast. So I don't think there's anything wrong with having fruits and vegetables for breakfast.
You've mentioned fruits and vegetables, but you haven't mentioned anything about animals.
Right.
So would you consider animals processed food, or is that something people can consume and still see reversal effects?
Yeah, so I would consider, in an odd way, I would consider animals processed in that animals don't produce these phytonutrients themselves. It gets filtered through them. And unfortunately, if you choose to eat animal products, and we're talking about meat or dairy, cheese, eggs, you're basically getting much higher levels of toxins, because as you go up in the food chain, whether on land or sea, you're getting much higher levels of fatty toxins. So I would recommend normally people avoid or limit the amount of animal products and just try to focus on plants, fruits, and vegetables.
So you mentioned fatty toxins in the animal products, and before you said one of the root causes of Alzheimer's was fatty toxins. So is consuming animals one of the causes of Alzheimer's in your opinion?
In my opinion, yes, it is. And the good news is we now have technologies to filter out some of these fatty toxins from the blood, but it's a lot easier not to introduce more of these toxins in the first place.
You've mentioned intermittent fasting, where a person has a long eating window from the time they go to sleep to their next meal the next day. What about water fasting or juice fasting long term? Has that been proven to be helpful?
And I guess it depends what you mean by long term. And the first thing I would say is if you're water fasting or juice fasting, I would try to do that under medical supervision. I mean, so for example, when I was at True North, for a few years, we would do water fasting for up to 40 days. But it was under medical supervision. We were rounding on patients twice a day. I don't recommend, certainly for more than a couple days, people water fast or juice fast, at least without seeing their doctor first, because when you start making a change like that, potentially you can stir up and bring up medical issues if you have some to begin with.
Do you think, or have you seen when you were at True North, which is a medically supervised fasting retreat, when you were there working, did you see people with Alzheimer's have reversal effects through long-term water fasting that's supervised?
I did. I saw some patients with brain fog and other inflammation of the brain. Their inflammation went down when they were water fasting. What was fascinating, people with inflammatory diseases often, or sometimes, those same diseases or inflammation would come back when they started refeeding, unless they were very careful and having a low inflammatory diet. So for example, not including gluten or other potentially inflammatory foods, or even animal products, which can cause inflammation.
Okay, now another thing is exercise. You mentioned that. Is lack of exercise possibly a cause or contributor to Alzheimer's?
100%. So it's exciting. When you exercise, you actually stimulate your brain to produce something called BDNF, brain-derived neurotrophic growth factor, which stimulates new neuron growth and neural connections. So to my mind, and this is what I tell my patients with Alzheimer's and other dementias, you want to be exercising every single day, because that's more powerful than any other treatment that I can provide. Now, obviously, if someone's sedentary, they're not going to go from sedentary necessarily to exercising, an hour every single day. But that's the goal, and that's really important.
Sure. And preventative wise, also, if somebody has Alzheimer's, is it recommended to get them exercising?
It is, definitely. But obviously, if someone doesn't understand, they're going to need some help or coach. And, I may have patients who have a trainer 3 days a week, but I'm like, okay, so what's going to happen on the other 4 days? It's that important.
I know there are certain conditions like osteoporosis and other muscle conditions that need muscle resistance exercise. What's the best form of exercise to help people who have this brain illness?
So there are basically, to my mind, 3 different types of exercise, and I think they're all important. You've got aerobic exercise where you get your heart rate going, because guess what? The heart's important. We want to pump oxygen up to the brain, so that's number 1. Number 2 is we have strength training. We want to build muscle. And then number 3 is working on balance, because the last thing you want to have someone do is elderly fall, break a hip, and then have a 50% risk of passing away in the next year because they're they're bed bound and they end up getting pneumonia or infection in their lungs.
Sure. You've mentioned not eating 3 hours before going to sleep. What is the significance of that?
Sure. So if you end up eating right before you go to sleep, a few things happen. Number 1, when it's interesting, when your body's trying to digest after you eat a meal, that takes a lot of energy. And so if you let's say you eat a big meal and go straight to sleep, your body's like, well, guess what? I need to devote a lot of energy into digesting what you just ate. And that energy and blood supply is going to be focused on your gut, and it's not going to be focused on what we're talking here, your brain. Because one of the important things is to get deep sleep, because when you get N3 deep sleep, your brain is able to get rid of amyloid plaque and is able to consolidate memories. But if you're eating right beforehand, your brain cannot get into that deep sleep because it's focused energetically on digesting that meal that you just ate.
So basically, don't eat before going to sleep because the quality of sleep is going to determine when healing's able to take place?
That's one piece. Another is it tends to lead to insulin resistance if you're eating right before you sleep too.
Okay, so on that note, is it common for people with diabetes to have Alzheimer's later in life?
It is. And in fact, because of the very common connection, Alzheimer's has been called by some scientists type 3 diabetes. And to be clear, I'm not saying that the only cause of Alzheimer's is diabetes or insulin resistance. I'm saying it's definitely one category of the 30 to 200 root causes that we commonly see.
All right, type 1 and type 2. Type 1 being supposedly hereditary, type 2 being supposedly somewhat diet-related.
True.
Type 3 would be what, a little of both?
A little bit of both, and maybe focus more on the type 2 but maybe a little of both, because if we're talking about insulin resistance affecting the brain, it can be both genetics and what you choose to consume.
And what about supplementation? What's the role of supplements in preventing or reversing Alzheimer's?
Yeah, so I'm a big fan of supplements too, but let me just be clear. I'm not saying that if you just take a few supplements, you're going to be able to prevent and reverse Alzheimer's. To me, it's supplemental. It's supplemental to the lifestyle changes we just talked about. So one of my favorite supplements is to get an omega-3 from algae oil in order to increase your levels of DHA, DPA, and EPA, which are important omega-3s in the brain.
And you've mentioned somebody to go on a vegan diet with no animal products. So without this supplement on just the diet you said, are they able to get these omega-3s?
Generally not. And it's interesting. I don't want to risk it and we have tests. We can measure people's omega-3 in their blood levels. Many of my patients have low omega-3 levels, so that's, you can do testing for it. But to my mind, on the safest level is to supplement with omega-3s.
What about hemp seeds and chia seeds? Some people on a vegan diet say they use that to get it.
Right, and that might work for some people. Here's my concern. If you look at those types of seeds, they have an omega-3 called ALA. And the problem and the issue is some of my patients are not able to convert the ALA into the EPA and DHA and DPA in the brain. And I just don't want to risk it. So I'm not opposed to those things, but I just worry that it's not enough.
And how do we measure success of somebody who's been diagnosed with Alzheimer's and you're working with them? How do you measure if what they're doing is working?
Yeah, so a few different ways. Number one, I'll normally do computerized tests once a month to measure things like their ability to recall specific words or shapes, to look at their processing speed, which gives me an objective test to do. But I'm also talking to them and their family, because often the first thing that will improve isn't the memory, it'll be their interaction. They'll be more interactive with friends and family.
What kind of medical doctor are you?
I like to think I'm a pretty good one, but yeah. So
Did you train in one particular thing going to school?
Sure.
Or?
So I have 2 degrees from Harvard, 2 degrees in biochemistry. I think that's important. I'm board certified in both emergency medicine and lifestyle medicine. To be clear, I'm not a neurologist, but I ended up getting into this field because, to my opinion, most neurologists are not focused on bringing cutting-edge technologies to prevent and reverse Alzheimer's.
Do you personally know people that have suffered from this?
100%. I actually, one of the reasons I got into this whole field is when I was a teenager, my own grandmother, Eileen, got Alzheimer's, and I saw how it affected not just her, but my parents and that generation, where they're like, wait, this happened to Grandma Eileen now, what's going to happen to us in 20 or 30 years? And I was, as a teenager, I was a nerd. I was actually studying biochemistry as a teenager. So it's cool, many decades later, now I can actually use what I learned to help people.
And you've mentioned, when you were at True North, this fasting place, that you've seen some people have success with fasting. What are some other case studies that people you've worked with? What's the farthest somebody was diagnosed, and how far did they come back through working with you, and how long did it take?
Sure. So I would say the longest took actually over a year of a patient with advanced Alzheimer's. We had to do intensive daily intravenous therapy to push out the fatty toxins and to get their, and also they also had infections to treat the infections in their brain, and it took over a year. What's cool is we now have better tools for regenerating the brain. I mentioned this FDA-approved drug for compassionate use that goes after galectin-3, but we also can now filter the blood using something called total plasma exchange, which takes blood out of one arm, removes all the toxins, and in the other arm you put in albumin. So, and then another tool we now have is something called exosomes, which are a collection of over 500 different growth factors that can stimulate the brain. And we also have peptides, and we're using oxygen therapy and hydrogen gas therapies. We have so many more tools, but to give you an example, have one patient who I talked to a month ago, and she actually, we gave her 6 doses of this medicine to decrease inflammation in the brain by going after galectin-3. We got her memory back. We brought her back, and she told me, "Yeah, Susan," she whispered in my ear, "You gave me my life back." And I mean, there's nothing like that as a physician. I mean, that's why I went to medical school is to help people. And unfortunately, it's not just her. It's like I've seen this so many times where we're able to bring people back. Yeah.
When something like that happens, does a person know where they were? Like, do they remember that they couldn't remember when they come back?
It really depends on how far gone they were, right? If you have someone with very severe Alzheimer's, no, there's going to be a time gap there where they're not processing. And what's really interesting is when we're trying to bring someone back, it's almost like, I think it is. It's like teaching a little baby. I know you've got some young ones, and one of the important things with young humans is you don't want them to be looking at a screen all the time. The same thing with adults with Alzheimer's you're trying to reverse. The key is human interaction. So, and I say this because the default at many memory care centers is you put someone in front of a TV all day. That's their babysitter. And unfortunately, television is not interactive enough. You actually need human interaction.
I was going to ask you about the social aspect, and human interaction with others. So how important is that in treating people, not only with the supplements and the medicines you're talking about, but just in general? How important is that they have that human?
Yeah, it's very important. It's to me, it's part of lifestyle. It's to be part of a community, part of friends and family, and part of that human interaction. So I would put it right up there with exercise and sleep and eating a good diet.
You mentioned oxygen earlier, and one of the things that's on just the beginning to become well known, but from what I hear is extremely important, is hyperbaric chambers. Have you explored that and have experience with that?
Yes, some of my clinics, my Alzheimer's clinics, have hyperbaric oxygen. I'm a big fan. I've seen good results using hyperbaric oxygen.
Wonderful. So I have a curious question, because the brain, there's so many different functions to the brain that moves different organs in the body and so on. But Alzheimer's, is it just memory, or is it also where your brain forgets to do something in the body it's supposed to do?
Yeah, it's fascinating. It's not just memory. It's also behavior, interactions. Yeah, it's remembering how to do things, remembering how to put your clothes on. It's fascinating.
Yeah, but these are memories of like lifestyle memories. But does your body forget? We breathe voluntarily. Can your brain be so damaged from old times where it forgets how to breathe, or something like this? Or the brain moves our muscles? We have so bad where our brain stops?
Yeah, unfortunately, I've seen some of those cases. It's tragic.
And is that how people ultimately succumb to the disease, where their brain stops telling the body to do certain functions?
Correct. So, for example, you stop eating. And if you don't have someone there reminding you, hey, it's time to eat something, they forget and they wither away.
Well, what about like going to the bathroom? Does the brain tell people or they forget to go to
or the reverse, they forget to be continent. So they need diapers.
Gotcha. Wow. So what's your recommendation if somebody's watching this and they have a relative that's getting older and starting to show signs of poor memory? Is there a certain test they should go? And they definitely contact Dr. Josh. I'm going to put his contact information below. But what's the first step somebody should take? So
the first thing is to understand that there's hope. And I say that because if you go take your loved one to your primary doctor or a neurologist, yes, you do want a workup. You want a brain scan to make sure you don't have a tumor in the brain, to make sure you haven't had a stroke or a blood clot. But in addition to that, often patients are told, there's really not a lot of things we can do for you. And there's no hope. And so I think that's the most important thing, is that if you're watching this and you've been told by a medical doctor or someone else there's no hope, that's not true. There is hope. Definitely reach out to me or someone like me who is focused on using a more functional approach to put this all together. And I would say you want to do a complete workup, going over all the different things we talked about. Is this person exercising? Have they been tested for toxins? Have they been tested for infections? Have they had a brain scan? Have they had head trauma? Have they had not just a CAT scan or MRI of the brain? Have they had a PET scan or EEG of their brain to look a more functional test to see is there just one area of the brain that's not working, or is it everything? And just to be clear, every case is unique and different. So just because you may have heard of someone and there wasn't a lot they could do to help, please get a second or third opinion.
In the traditional medical community, what is the prognosis on Alzheimer's? Is it something that's reversing it, is it becoming common, or is it something that seems like there's nothing people can do traditionally?
Traditionally, the patients would be started on a medication like Aricept or Namenda, which would increase neurotransmitters in the brain, for example, and that might buy someone, it would slow down the descent. It would slow, instead of going down quickly, they might get an extra year of time, but normally those medications wouldn't do reversal. There have been some newer medications on the market going antibodies after amyloid. I'm not a fan of those because in a third of the patients, they get brain bleeds and brain swelling and actually require a brain scan every month to catch the brain bleed or brain swelling early. So I'm not, because of those bad side effects, I'm not a fan of that. And that's why I'm really excited about this FDA-approved drug for compassionate use that decreases inflammation of the brain without causing brain swelling or bleeds in the brain.
What have other doctors said about what you're doing and the work you're doing? Is it somebody they would recommend their patients you to go see, or are they completely against it and say it's nonsense?
It's interesting. I think it's a continuum. There are some doctors. So, for example, last week I was at a conference of biological dentists, a few hundred in South Carolina, and they were really excited. The audience was really excited to hear about this. But there are also traditional doctors who say, oh, if you're saying that you can cure or reverse Alzheimer's, you don't know what you're talking about. And so there's a spectrum. But I will tell, if people are listening to this and they're skeptical, like, what is Dr. Josh talking about? I'm just going to refer you. There's an article published last year by Dean Ornish showing in 20 weeks he was able to reverse Alzheimer's using lifestyle in just 20 weeks. And then there was another article published just a month ago called the U.S. Pointer Study, similarly showing that lifestyle was able to reverse Alzheimer's. So fortunately, this isn't just my opinion. The word is slowly getting out there. I think it may take a few more years, but that's why I'm out there. I have a weekly podcast on this called Alzheimer's Breakthrough. And again, my message is one of hope. If I may, can I address, because I know you have a large audience of people who love fruit. Even though I'm a big fan of fruit and plants, there's one class of fruit that I'm worried may be causing Alzheimer's or Parkinson's down the road for people who eat a lot of pawpaw or soursop because of a specific toxin in those fruits called, I think it's called allicin. Yeah, so you have to be careful what you do. I'm not saying all plants are non-toxic, and I'm sure you love soursop.
It's very interesting what you say, because I have a channel and I talk about fruit, and it's the Annona family fruits that have this toxin, and it's something that I speak about that I haven't heard people talk about, so I'm glad you're bringing it up. It's not just soursop, it's something called sweet sop or sugar apples and such things like this. and also pawpaw is supposed to have the most of this, which
Right.
isn't in the Annona family.
Right.
But it's a study that was done in the Caribbean where it wasn't the same type of dementia that they found, but they still found that too much of this can cause it. So it's very good. Now, I asked somebody else, and it's very interesting that they said, because the leaves of the soursop tree are supposed to be great for cancer, and this toxin is one of the reasons why.
Right.
Here's the problem. There's nothing to measure it. So each tree can have it in different dosages, and it's
Right.
not, so you could be doing a lot of damage. But I know another doctor that I had on the show, and he got rid of all of his cherimoya trees because
Right.
they're in the same family. He didn't want to even risk it. From what I've heard is you have to take an extremely high amount of these fruits for it to affect you. But with no measuring of it, why risk it? So would you recommend somebody completely stay away from these type of fruits, or would you say have it very sparingly?
I think it depends which one we're talking about. So specifically pawpaw, and I'm not talking about papaya. Papaya is fine. But there is another type of food called pawpaw with very high levels of this toxin that basically causes damage to your mitochondria in your cells, in your brain, and elsewhere. So for that information, because it has very high levels, I would say just stay away from pawpaw completely. And then so I look at the levels of concentration. So soursop has not as much as pawpaw, but it has a significant amount. I would not eat a lot of soursop. Now, and the reason I think it's important to talk about this is you have listeners who eat lots of soursop and potentially pawpaw, and you don't want to do that because this fatty toxin will accumulate in your brain and elsewhere, and then maybe in 10, 20, 30 years, you'll develop a syndrome like Parkinson's or PSP, which Dudley Moore had. So yeah, it's so for me personally, I stay away from pawpaw, soursop sparingly, but I think it's important that you actually have listeners who will eat some of these fruits as a staple.
The thing is, some people said the soursop leaves, which are often used to fight cancer, people use a lot of this if they have cancer, and it might very so fight cancer. However, it also has this toxin. So even in the Caribbean, they say don't drink too much of the tea.
Right.
And I see people that are into alternative health that have been diagnosed with cancer or know someone who has, they consume a lot of tea, and this could be creating a problem.
Right. And what I would say is, let's say someone out here listening is treating their cancer with the leaves, and it's working. Hey, do it. But after you're done with the cancer treatment, come to someone like me who can then detoxify and remove the fatty toxin from the soursop leaves.
And you mentioned Parkinson's. Is that another form of dementia or Alzheimer's? Or?
So Parkinson's is interesting. Parkinson's, in some cases, patients will also develop dementia, but sometimes it's just a motor problem. So guess what? Everyone's brain is different, and it really depends what part of the brain is affected. But in about half of the patients I see with Parkinson's, it's just motor, but half they'll have some dementia with
So
it.
these toxins in these fruits that you're talking about is not just Parkinson's, they can contribute to Alzheimer's as well, is what you're
Correct.
Yes.
Correct. They can, and what I find fascinating is when I analyze patients with different diagnoses, whether it's Parkinson's dementia or Alzheimer's or PSP or ALS or anything else, when I look at the root causes, often they're identical. It'll be fatty toxins, it'll be mold, it might be Lyme spirochetes, it might be parasites, it might be prior head trauma. Again, you're looking at 30 to 200 root causes, and you just have to analyze which ones those are. But it's important to go after the root causes, and that's, I find, more effective reversal of these symptoms if you actually go to the root causes, as opposed to just trying to find a medication unique to, say, ALS.
So we know processed food creates this fatty toxin, which creates a problem, right?
Well, unfortunately, with processed foods, you're have often high levels of added salt, oil, and sugar, and those three substances will cause damage to blood vessels and even a vascular dementia type picture. So that's one reason I would recommend people stop with processed foods.
Would you consume a soursop if I gave you one?
I would probably have one, but if you gave me a tree, and I would say, thanks, but no thanks.
Okay. So one a year you would have?
I might even have 2 or 3, but I certainly wouldn't have any pawpaw.
Okay. All right. And,
and I'm not treating cancer, so I wouldn't have the leaves.
now, when you say salt, oil, and sugar, is that within processed food, or is that just straight up, no salt, oil, or sugar straight up?
I would avoid adding it in either processed foods or any other food that you happen to be eating.
Now, oil's interesting because you mentioned taking this algae oil
Sure.
For omega-3s, but now you're saying don't take oil. So isn't extracted algae oil supplement an oil?
It is, but what I'm saying is take 3,000 milligrams a day or 3 grams, and that's the only oil I'm suggesting you add to your diet or to your system.
Okay, so that's important that
Yes.
people know that, and so you're not confused when you say no
Right.
oil.
But I can see it's like you said, no oil. Why are you recommending algae oil? And I'm recommending a very small amount of algae oil, specific omega-3.
Now, is there any connection between cancer and Alzheimer's? Do you, because I often find people that have Alzheimer's, they don't seem to have cancer, or vice versa. Is it common for people that suffer from both?
It's not that common. It can happen, but here's one thing where I say there is a commonality. I often see elevated levels of this inflammatory protein galectin-3 in cancer, and I also see elevated levels of galectin-3 in Alzheimer's. So in terms of the root causes, I think often they're the same. Not enough exercise, too much of this inflammatory galectin-3 protein. But no, I don't normally see patients who both get cancer and Alzheimer's at around the same time.
With the omega-3 and the algae oils, if somebody doesn't take the algae oils and they take the test, is it possible they can have enough omega-3s from maybe they've gotten it from their diet, or does that mean they're different, or is it 100% they're not going to get enough if they're not taking the oil supplement?
Yeah, so I'm not going to say 100% because it's fascinating. Everyone's metabolism is different. We talked a little bit about it. One of my concerns is, let's say someone is only supplementing using ALA from flax, as an example. If they also in their diet have high levels of omega-6, it's the same enzyme that converts the omega-6 and the omega-3. If that enzyme is busy with too much omega-6, it's not going to be converting the ALA into DHA, DPA, and EPA.
Do you recommend somebody start taking the supplement, or do you recommend people take the test first to see if they need the supplement?
Either way. But often if I'm seeing someone with dementia, I'm like, let's not wait for the test. Let's get you started on the supplement.
And what kind of test is it to check?
Yeah, there are different names. It's basically a blood test looking for the ratio of omega-3 to omega-6.
And omega-6 is common in fruits and vegetables, but it's not common in omega-3 is not common. Is that correct?
The way I would look at it is in human diets hundreds and thousands of years ago, omega-3 and omega-6 were normally consumed in similar amounts. But in today's highly processed food diet in the United States and elsewhere, most people consume way more omega-6 and omega-3. So I think it really depends.
So if they are getting a better ratio, does that mean that they're probably better off, or not necessarily?
A better ratio, more omega-3 than omega-6, yeah, they're probably better off. Again, my concern is if that omega-3 is mainly ALA, you, for some reason, may have a genetic defect not allowing you to convert that omega-3 ALA into the EPA and DHA that your brain needs.
Some people watching this might just say, I can get these omega-3s from eating fish, Why can't I just eat some fish and not have to worry about this supplement?
Yeah, the problem with eating fish, and it's true, you can get omega-3s from eating fish. Unfortunately, in addition to getting the omega-3s from fish, you're also going to be getting heavy metals, pesticides, plastics. You're going to be getting toxins because fish are on the top of the food chain. And there's bioaccumulation up the food chain. So believe me, you don't want to get extra mercury and other toxins through the fish. The other problem is many of these fish oils I see marketed are rancid. And oxidized omega-3s, instead of being helpful, in my opinion, are inflammatory and not helpful.
Well, I hear that about the actual supplements themselves. So if somebody's selling omega-3 algae oil, let's say, I hear they could be rancid as well and run into the same issue. So how do you test for that, or how do you know that?
Yeah, so what I would ask for is before you buy or take a specific omega, ask for from that batch, not from something from many years ago, ask for that batch, say, I want to see the testing sheet, third-party testing that shows, number one, does it actually have the omega-3s it claims it has? Number two, does it have has it been tested for heavy metals? And I want to see the results showing it's low in heavy metals like mercury and lead and arsenic and cadmium. And then finally, I want to see evidence that it's not oxidized or rancid. And they can do specific testing looking for the oxidation. And then the other tip I have for you is then if I find an algae oil that meets that test, I store it in the refrigerator because heat will tend to cause the double bonds in these omega-3s to get oxidized and get rancid. So I understand people may not be purchasing these omega-3s refrigerated, but if you're storing them, please store them in the refrigerator.
Well, does it make a difference if it's sitting in some hot warehouse for Amazon and then you get it and put it in the refrigerator? Does it make a difference?
It does. So obviously you don't want oils, algae oils that have been sitting in hot warehouses. But the flip side is you do the best that you can. And just because it may have had, 24 hours in a hot vehicle, causing a little bit of oxidation, you don't want to magnify that by keeping it in a hot area and magnifying and increasing the rancidity.
Have you found a particular algae oil that's not rancid that you've had tested that you can recommend?
Certainly, yeah. The one that I take for myself and recommend is from a company called Nordic Naturals, and I like it because on the actual box that it comes in it actually has a lot number that I can plug into. They've got a QR code, and I can actually look for the sheet of, does it actually have the omega-3s it claims it has? Making sure it doesn't have the heavy metals, and making sure that it is not rancid. But I'm open to other companies. It just happens to be the one that I found.
And it says on there that it's not rancid on the reports?
Correct. That's one of the section. It'll actually, at the bottom part, there are two different tests they use for oxidation.
Okay. So if somebody has a caregiver and they're dealing with this situation, and what's one thing the caregiver can do this week to change things around? And
Yeah, so I'm going to give you more than one. The first thing is if you're a caregiver, I think self-compassion is really important because as humans, we're not designed to be caregivers 24/7 to someone with dementia. So I've seen this so many times when caregivers took this personally and actually their own health suffered severely, whether they got a heart attack or other chronic conditions. So the first thing is I would say self-compassion, get help, understand that as a caregiver, you're not able to do this by yourself, and then seek help from someone like me to help the person you're taking care of. But also there are self-help guides. There's a book I like called neurobiology to the rescue, caregiver stress. Caregiver stress, neurobiology to the rescue. The author is Heidi Crockett, and it's a workbook. I would recommend that book to help you through it because, yeah, caregiver stress is real. It's deadly. And, now we have not just one person who's sick, but we have potentially more than one.
I know this is a very personal question, and the answer might be personal situation-wise, but if somebody has a parent who is suffering from Alzheimer's and seems to be getting worse, when does a person make that decision to put them in a home versus keep them at home?
That's really tough. What I would say is I'm now offering people a third choice, which is instead of taking the money to put them into an expensive home, take that money, bring them to one of my clinics or someone doing what I'm doing. It may be the same funds, but instead of every month someone getting worse, every month someone should be getting better.
Good answer. Good answer. Okay. In closing here, I have a couple of more questions, and then we'll close. But what's the most overrated brain health tip you see out there commonly that you think, well, that's really overrated? I don't necessarily think that should be the number one thing people are talking about.
Right. Specifically, I mean, there's so much misinformation out there. Where to start? I'd say the number one is that there's no hope, because there is hope. But if you watch many of the programs on Alzheimer's, or what you hear from physicians or others, is that, yeah, we can try these few prescriptions, but it's not going to get better. And what I'm telling you is the exact opposite, because I go to conferences where literally there are 80 new different treatments down the pike coming. So to my mind, we want to stop the downward descent, start on the upside, so we can actually start using some of these hopeful potential treatments.
What's the most underrated lab test that you recommend people should get, but it's not normally recommended for this?
And that's a tough question because there's so many. I would say either heavy metal levels or forever chemical levels. And we can measure both of those in the urine, as an example.
Okay. You mentioned earlier about a holistic dentist conference you just spoke at. Is there a common connection between modern common dentistry and Alzheimer's?
100%. And the lecture I gave there was how Alzheimer's starts in the mouth for a lot of different reasons. But it turns out that there's a gram-negative bacteria, a bug called P. gingivalis, that not only causes dental decay, but also has been found in 91% of patients with Alzheimer's. So there definitely is a dental connection. Please take care of your teeth. See a biologic dentist. And there is a connection. And it was really exciting speaking to the group because I could tell most of the biological dentists understood this. And I helped them understand in their practice, literally, they have personally been preventing and helping reverse Alzheimer's, and they didn't even know it.
Wow. From a technology standpoint today, are there any connections to Alzheimer's, such as putting these cell phones near our ears or plugging something in our ears or sit in front of a computer all day? Are there connections between technology and Alzheimer's?
I think there is, unfortunately. I think when you talk about the energy of a cell phone or being right near a cell phone tower, that we know that type of energy is biologically active. And I'm concerned that some of the increased amounts of dementia we're seeing is from that type of exposure. We don't have the studies yet to prove it. I'm just strongly suspicious at this point.
Okay. So you personally, who are so strong about this not getting Alzheimer's, what's one habit that you definitely don't skip every day? You definitely make sure you get something done. What's one thing?
For me, it's exercise. I want to make sure that I'm exercising and sweating, because not only will exercise increase my heart rate, but the sweat will also get some fatty toxins out of my body.
And also heavy metals, right? That gets heavy metals out as well.
It can, but what's scary is some of these heavy metals like mercury can stay in bone. You actually have to, you may need to use chelation or another process like the total plasma exchange I mentioned.
What are some medically diagnosed illnesses that people have been diagnosed with that are connected to Alzheimer's, where if they go to a doctor and they've been diagnosed with something, the doctor would often say or should say, you should also get tested for this?
Yeah, so it's interesting. We find, for example, people who are hard of hearing are at increased risk of developing Alzheimer's. And there are many reasons why, including often people lose their hearing because of increased inflammation in their brain. And often we see increased inflammation associated with Alzheimer's. But that's one example.
Okay. And what's a myth about Alzheimer's that you wish would die?
The myth, again, is the same as before, that there is no hope. There definitely is hope. And yeah, so I would say it's a myth that we cannot cure and prevent and reverse Alzheimer's.
Where can people find you and your work that you're doing about Alzheimer's?
Yeah, many different places. Probably the easiest place is just my website, drjosh.com, drjosh.com. My email address is just drjosh, drjosh @drjosh.com. I'm on all the social media under Green Brains MD, Green Brains MD. And then my weekly podcast on Alzheimer's called Alzheimer's Breakthrough is available on all the different podcast channels. Easiest place to find that is drjosh.com/podcast.
Do you take medical insurance?
The answer is medical insurance normally only covers simple tests. It doesn't cover a lot of the cutting edge technologies. So generally no. And it's really frustrating that, so for example, the expanded access drug for compassionate use that decreases inflammation in the brain, that is not covered by insurance. Often hyperbaric oxygen is not. Total plasma exchange in most cases is not. We try, but in most cases it's not. The testing for heavy metals, for plastics, those are considered functional tests, normally not covered. So, if insurance will cover like a complete blood count, chemistry, simple labs, yeah, maybe we could use it for that, but it's frustrating, definitely.
A good friend of mine's father is suffering from progressing Alzheimer's. In closing, if he's watching or someone else is watching, what would you like to share with people before we close?
Yeah, so I would say get a second or a third opinion. Talk to someone like me. Make all the testing that you've had done so far available to someone like me, and then be open to other treatments and other testing to help guide treatment. Because to my mind, what do you have to lose?
All right. Thank you for coming on the show. And everybody, put your comments and questions below. And keep up the great work.
Peace and plants.
Nature's wealth, good for your health. This is the Raw Life Health Show.